Hi neighbors, it's your friendly City Council member at large, Sarah Keppel, back to talk with you again about an important update here in our community, which is the requirement to wear a mask when you are out and about in public, in buildings, or when social distance isn't possible. So right now I'm standing here outside of City Hall. There's not a soul in sight for at least 100 feet, so I'm all right now. But what I thought we'd do is, since there's some important information and some news coming out of City Hall to keep Lakewood residents safe, I thought we'd go talk to the mayor. So let's mask up, and now let's find out what's up.
Hi, Mayor Megan George here, coming to you from my office at City Hall. I want to spend a little bit of time talking about masks and the proper way to wear masks. It's really important for all of us to be wearing your mask when you're indoors or when you're outside and cannot practice social distancing. The science has proven and the CDC guidelines say that we should be wearing masks to slow the spread of the coronavirus. So initially during the early time of the pandemic, the governor was really kind of leading the charge with coming down with guidelines that we were able to implement. At times we'd make more stringent guidelines based on our population density, but a lot of times we're able to follow the guidelines of the governor. Recently he's kind of switched course a bit and really pushed some of this onto the local municipalities. So with that shifting of gears, we found it important that Lakewood implement our own mask requirement. This was being worked on before the governor's order because it's very important that we take care of the public health and the public safety of our population. Again, we're the densest city in the state of Ohio, and so with that density comes more proximity, so it's very important that we're abiding by all these guidelines set forth by the CDC. We're faced with a once in a century type of pandemic, and it's going to take all of us working together to be part of the solution. We all have to work together. We all have to wear masks. We all have to social distance, and we all have to practice good, healthy hygiene to make sure that we are part of the solution, that we're slowing the spread. I know we can do this, Lakewood, so be part of the solution with me.
So also part of the solution is Council President Dan O'Malley. So I hopped on a quick Zoom call with him, and let's hear what he has to say.
President Dan O'Malley, and I represent Ward 4, the east end of Lakewood, Gold Coast, Birdtown, Rockport, and it's great to be here today. I think we found that we were having a hard time enforcing statewide health mandates when they weren't really incorporated into our code. And so what we did was we basically are mirroring those statewide health mandates, but including them as the law here in Lakewood. That will allow us to have a lot more authority when it comes to enforcement. It also gives us the opportunity to decide our own ways of correcting those issues, whether it be through warnings or fines. And I think it gives us a lot more power to enforce these things and to decide how we want to deal with them as they come up. Especially in the last few weeks, I've really noticed that businesses are doing a great job insisting that their customers wear masks. That's really important. I can't remember the last time I went to a store where I didn't have to have my mask and where they didn't have signage on the front door that said that you must wear it. And so that's something that I think businesses are doing well. I think that especially in Lakewood, people are really on board with the idea of social distancing and keeping things sanitary. Those are some of the things that I think most businesses are doing very well. So the requirements are going to be that you've got to wear a mask when you're in public. This is going to include all businesses. And then, we also want to make sure that particularly in restaurants and bars, that there's 6 feet of distance between parties, that those parties are limited to sizes of 10. And we're also encouraging that businesses have plexiglass or plastic barriers between the tables as well. We think that that's really helpful. The more we learn about this virus, the more it's been determined that this is something that's spread through airborne uh, droplets and transmitted directly from one person to another. And so I am far more concerned about limiting that exposure than services, for example, although both are certainly very important.
So, like Dan mentioned, we keep learning more and more about this virus and how it works. And so I thought we'd come here to Lakewood's Fire Station number 1 and talk to some experts. So about these droplets and learn a little bit more about masks. Our local Lakewood firefighters have been wearing their masks here in the station to keep each other safe and out in the community to keep you safe. So let's go find out what they have to say.
Well, we have several different kinds of masks we wear. We wear the surgical mask around the station, and it's to prevent if we're spreading the virus to anybody that's around us here. So that's important. We have to stay healthy ourselves to take care of these people. We also have our N95 mask, and that's for more of the high-risk patients that we go on, because it further protects us from getting the virus.
So it's important to wear a face covering of any type because, as Mary mentioned, we are wearing surgical masks around the station because it prevents us from spreading potential virus to the people that we're working with. Obviously, our schedule, we live with these people, so our contact is a lot closer than most places. So that's why we're wearing the masks inside the station. And we've been doing this since the beginning, prior to any other mask mandates for our own protection. When you start thinking about why we wear N95s, primarily in the ambulances, we're putting those on in the event we have to do any type of airway procedure, so any type of breathing treatment where there's aerosol treatments, or if we're intubating a patient, we're wearing the extra N95 protection for those types of situations. Or if we go into an environment like a nursing facility where the patients are extreme high risk, if they get COVID, they have very detrimental outcomes, we're wearing the extra layers of protection. But majority of our EMS calls, just the basic calls, unless there's presenting like COVID-like symptoms, we're wearing the normal face masks, the surgical masks, and then we place one on the patient as well, so that if they aren't even calling for a COVID-like complaint, they may be an asymptomatic carrier, and we're going to protect them from expelling that virus in the back of the ambulance as well. So obviously, if you don't have any face covering on, and I am standing next to you and I cough or I sneeze, the theory of the science says that it can travel about 6 feet. That's where the social distancing of 6 feet has come from. So if you have nothing protecting you, or I have nothing protecting me from expelling that out to you, then the particles or my saliva or my droplets are then affecting you. You're inhaling it. It gets into your mucous membranes. It gets into your lungs, and then that's how the virus is transferred. So if I'm wearing it and I sneeze or I cough, I'm still supposed to cover my mouth with my elbow and still take all of the normal precautions that we do. But the extra layer of protection is if I go and sneeze and I'm 6 feet away, or if I'm even less than that, and I take my precautions, and Mary's wearing a mask. I'm not sure the exact number, but it's somewhere around like less than 5% chance of that spreading to the other person.
Another important thing is constantly washing your hands. It can live on surfaces. If somebody coughs somewhere, somebody's got it on their hand because they touched their face and it's on a surface. So you constantly have to wash your hands and keep your hands away from your face, because you can also spread it that way. Okay, the first thing, the dispatcher, besides asking what your complaint is and why you need EMS, they're going to ask you certain COVID questions. That's protocol, okay? We want you to be honest, and if you've had any of those symptoms that they ask, or if you've been around anybody that's positive, you need to tell them that before we get there. When we get there, whether your call is for something serious like shortness of breath or an ankle injury, we require to put a mask on you, okay? So please don't get upset if we put a mask on you for a simple ankle injury. It's just our protocol to help everybody to keep safe.
So the best thing you can do to help be part of the solution and help us do our jobs and not overwhelm the healthcare systems is to wear your mask, follow the governor's directives for the county, and make sure that you are constantly washing your hands. You're wearing your mask in public places, on all the guideline locations like public transportation, and even if you're outside and you can't maintain social distance, such as we are right now. You have to wear your mask and help us try and get through this, keep everybody healthy. And just like we tell the employees here, if you are not feeling well, even in the slightest, stay home and stay away from people just so that we don't spread more illnesses around, especially COVID.
Okay, so if you are in need of a mask, there's a couple places you can get one. So the Giving Tree Project is giving away free masks to those who need them. But if you're really in dire straits too, you can always come down here to City Hall and they've got some extra masks that they can give you. So one way or the other, make sure you get a mask, and let's all be in this together, be part of the solution, and let's keep Lakewood safe. All right, stay safe, neighbors.